Hey, what's up, everybody? Dr. Weaver here with episode 2 of this year's Spinal Workshops, Wellness Workshops. We're going to dive into research, fun topic, regarding immunity supplements. Specifically today, we're going to dive into zinc and vitamin D. So you typically hear of vitamin C, or even, there's supplements now, emergency. Where if you feel like you're coming down with something or becoming ill or sick, that vitamin C has always kind of gained the spotlight. But we're really going to dive into the other two. This is something I personally take actually on a regular basis, regardless if I'm feeling run down or ill or sick, but more so just to keep my immunity all the way up as high as it can be. So, again, these wellness workshops, spinal workshops, we bring to you this new format in 2025, diving into trending topics, research. We're going to have some guest speakers on here as well, because we always want to educate our patients. We truly believe that is the most important thing we can do to you, to our community, and to our patients, is educate them. So, diving in, the first one that we're going to discuss today is zinc. It's a common mineral that you could hear of, or supplement, I should just reference them as that. Zinc is required for a lot of things in our body. Some of those you probably aren't really familiar with, but gene expression, immune function, protein and DNA synthesis, wound healing is another big one, growth and development as well. And the main one, as I mentioned, and they even state here in some of the research, that the benefits to strengthening our immune system. So, as you know, I don't like to read right from research papers, so I tried to reduce this down to the bullet points. So for our immune cell function and cell signaling, zinc is a very important thing. A deficiency in this could actually lead to weakened immune responses. As I go through here, we're going to try and actually maybe put up some of the links throughout here with YouTube and Facebook. That way you could click on some of the research too. Zinc supplements stimulate particular immune cells and reduce oxidative stress. So I want to pause on the oxidative stress part. If you've ever heard of an antioxidant, that is to help mitigate this. And inflammatory responses, oxidative stresses, those are all bad things for your body. And we typically see those become relevant when we become ill. A review of 7 studies demonstrated that 80 to 92 milligrams per day of zinc may reduce the length of the common cold by up to 33%. To me, that's pretty significant, 33% improvement there by keeping up a zinc supplement. Some more older research suggested that zinc supplements significantly reduce the risk of infections and promote immune response in older adults. Again, back to the oxidative stress, that can help relieve that and improve immune response by boosting the activity of T cells and natural killer cells, which help protect your body against infection. Those are legitimate things, legitimately called natural killer cells. So older adults who supplement with this, zinc that is, in some older studies, also experienced improvement with influenza vaccination response, reduced risk of pneumonia, and boosted mental performance. Foods highest in zinc. So again, you're going to hear us, I should have really just started this with, a supplement is a supplement. We try as much as we can to get it from natural food sources. Again, with everything being so mass produced, it's really hard to do that. So, especially around our area, a lot of people buy meat from, like a butcher or a local farmer for, cattle, even pigs, poultry even. I'm seeing that more often because it's less grossly manufactured in big plants. So some of the things for zinc: shellfish, meat, poultry, fish, legumes, nuts and seeds, specifically with that one, pumpkin and cashew, whole grains, certain vegetables, other animal products. Really the biggest one that you saw, and it was easy to absorb, would be the shellfish and meat. So a lot of information there. Again, what we note is zinc helps with oxidative stress and can also shorten the sickness from respiratory illness. So we're going to switch gears here, and we're going to go into vitamin D. So this is the one I had the most research on. Vitamin D is a fat-soluble vitamin, meaning that it dissolves in fats and oils and can be stored in your body for a long time. So again, things that you could become toxic with: A, D, E, and K. So you want to watch those fat-soluble vitamins. Now, there are a few main sources of this. Vitamin D3, which is more animal-based, animal foods, fatty fish, egg yolks, and vitamin D2, which is found in yeasts, plants, and mushrooms. Of the two, I felt like this was pretty fascinating. Vitamin D3 seems to be almost twice as effective at increasing the blood levels versus vitamin D2. The sources for that, a big one you're really going to see here is a lot of your fish. So salmon, cod liver oil was another one, tuna, beef liver, again, another trending topic there. You'll see a lot of liver supplements these days. Sardines, again, the fatty fish. So with the fatty fish, salmon, mackerel, swordfish, trout, tuna, sardines, yummy. They're decent sources, but you would almost have to eat them every day if that was going to be your source. Vitamin D, fish liver oil or cod liver oil, which contains upwards of 2 times the RDI, which is the reference daily intake, in a single tablespoon, which is 15 milliliters. So that kind of gives you a serving size. The one thing with this you'll see, ones that you need to take together, typically with vitamin D3, you're going to look at vitamin K2. Again, it's another fat-soluble vitamin that most of us don't get enough of. The research states that fat-soluble vitamins work together and that it's crucial to optimize your vitamin A and K intake while supplementing with vitamin D3. Magnesium is another one here. I wanted to try to get to that, but I wanted to get this to you guys. Magnesium is probably going to be one that we talk about here next month as well. And it's in importance alone, but also with vitamin D as well. So some other research articles, which I actually have right in front of me here. So this was a Spain study, which a study of 77 frail elderly patients hospitalized with COVID-19 in France concluded that vitamin D supplements taken regularly during the year before a COVID-19 diagnosis were associated with less severe disease and better survival than taking no vitamin D or receiving supplementation shortly after diagnosis. In a pilot randomized clinical trial of 76 patients hospitalized with COVID-19 in Spain found that treatment with high-dose vitamin D significantly reduced the risk of intensive care unit admission. So, a few little articles there on research through that one. Another abstract here, this was from 2021, stating that vitamin D can adequately modulate and regulate the immune and oxidative response to infection with COVID-19. But again, if you go back to that, we referenced that earlier, that it can regulate the immune and oxidative response as well. And one more article I believe I have for us, vitamin D. Several studies demonstrated the role of vitamin D in reducing the risk of acute viral respiratory tract infections and pneumonia. These included direct inhibition with viral replication or with anti-inflammatory or immunomodulatory ways. So, one of the things in our office that I always recommend to our patients is consider having in your house, in your cabinet, vitamin D, vitamin C, and zinc. Those are 3, again, I take them on a regular basis, especially this time of the year. I failed to mention this. Vitamin D, you hear a lot of that with sunlight. especially in the winter here. We're not getting a lot of that, or at least we're not going to be outside when it's 15 degrees for a long period of time. So again, especially during these colder months when we're inside a lot, you want to look at possibly supplementing vitamin D. Again, this is something, if you have a chiropractor, your physician, these are things that you should ask them what your levels may be. Again, as vitamin D, it is something that you could become toxic with, those fat-soluble vitamins. So it's always good to know where are those levels. So those are our supplements that we recommend if you're looking to boost your immunity, if you're under the weather or becoming ill. Those are the ones that we like to recommend in our office. So I hope this helps a little bit. Again, my goal for this year in 2025 is once a month we'll dive into some research articles. For the most part, they can be very complicated to decipher as you see a lot of numbers and clinical trials and things like that. So I hope that helps, or at least gives you a little preview to dive into some supplements that you may consider. I hope this helps. We'll look to see you again at our next spinal workshop, wellness workshop, and you guys have an awesome day. Hey everybody, hope you enjoyed that spinal workshop. Don't forget to like the video and feel free to share it if you learned something. Be sure to subscribe to our channel so you have quick access to our videos, and also don't forget to hit that notification bell so you are alerted every time that we post a video. You can also check out other spinal workshops by clicking right over here. Until next time, make sure you live your best life, and we'll look forward to seeing you at that workshop.